We are hosting a press conference to talk about the issues that are present in long-term care and the crisis that we're having in Ontario's long-term care homes. I'm going to turn it over to Natalie Mera, our Executive Director of the Ontario Health Coalition, and I'm going to reiterate that please leave the chat open. We're going to have a Q&A session afterwards where the media can indicate that they have a question in the chat, and we'll repeat the instructions afterwards. So I'll turn it over to Natalie. Please go ahead.
Thank you. Just for the media, we're not asking you to put your question in the chat, just to identify that you have one, and then we, Sala will sort of call on people in order to ask questions. And it's a media conference for all of the 100 organizations joining. So if you don't mind, please leave the chat open for media to be able to identify that they have questions. So we have a number of speakers here today. We called this press conference because we were deeply, deeply disturbed at the message coming from Doug Ford himself, our Premier Doug Ford, and from the Minister of Long-Term Care, really downplaying what is without question a crisis in Ontario's long-term care homes. Last week, Minister of Long-Term Care Merrilee Fullerton said there are no long-term care homes in a staffing crisis. This week, Doug Ford sent a message to Prime Minister Justin Trudeau saying that everything is hunky-dory here and to kind of get his nose out of long-term care. The Minister of Long-Term Care, Merrilee Fullerton, tweets out regularly numbers discounting all of the staff who have contracted COVID-19 in Ontario's long-term care homes, thousands of them. And downplaying the size of the outbreaks, the number of the outbreaks, and the impact of the outbreaks. We just cannot believe that this is the message from our provincial government, essentially the narrative that everything is okay and everything is under control. I'm going to run through the very quickly the province-wide picture at this point, and then we have a number of families of loved ones in long-term care or who have recently passed away in long-term care homes in Ontario to tell you what the situation is on the ground in the homes. I'm just going to share my screen for one moment. All of these reports and so on will be up on our website. This picture here is of wave 2. The red line is wave 2 compared to wave 1. It has not been reported, but at this point, we have exceeded the cumulative number of people, residents and staff, who have contracted COVID-19 in the first wave. So in the second wave, we're now far beyond where we were in the first wave. And at this point, you can see the escalation week by week is that there are more than 1,200 to 1,500 new cases per week, and that rate is escalating. At this point, every day, there are 2,700 or more residents and staff with currently active COVID-19 cases in long-term care homes. In terms of the deaths, which follow the infections by several weeks, and I want to just pause to say, you know, these are horrific numbers. They are human beings who have died. In wave 1 in total by July, mid-July, we had 1,924 residents and staff who had died. At this point, we're over 1,400 residents and staff who have died. We're going to surpass the number of deaths from wave 1 within the next 2 weeks. On average, 171 residents in long-term care are dying each week. What that means is that at this point, more than one long-term care resident is dying each hour in Ontario from COVID-19. Our message to Premier Ford is, if that does not constitute an emergency, what could possibly constitute an emergency? I'm just going to stop my share. I didn't want to get into too many numbers, but I want to give you a sense of the size of the outbreaks. The outbreaks are growing in size. They're growing in number. They have spread in geography across the province. And now we have the first outbreak that is confirmed to include cases of the UK variant If that continues to spread, then we are very likely on the cusp of a situation that is much worse even than what we have seen so far. At this point, there are 99 large outbreaks of the 250 long-term care outbreaks in Ontario. That means more than 10 residents and staff have been infected. Of those, 53 include more than 50 residents and staff. 100 of the outbreaks include 29 of the outbreaks include more than 100 residents and staff. 15 include more than 150 residents and staff. 7 include more than 200 residents and staff. 3 include more than 250 residents and staff. And 1 includes more than 300 residents and staff in the current outbreaks. At this point, we've been looking at the outbreaks because it's been widely reported that the Barrie outbreak is the fastest growing. In fact, there are a number of them that have grown just as quickly as the Barrie outbreak. And at this point, we think that there are about 17 long-term care homes in which somewhere between 90 and 100%, so almost all of the residents have been infected by COVID-19. Again, if this is not an emergency, Doug Ford, what could possibly constitute an emergency? At this point, we're calling for, again, immediate action to recruit the 10 to 20,000 long-term care staff that are needed with intensive fast track training to get them into the homes. Quebec did this in June. They did intensive training over 3 months. They recruited 10,000 PSWs. They deployed them into the homes in time for the second wave. And they've had a much better second wave than they had the first wave, and a much better second wave than we have. We're asking for immediate recruitment. And that means improving the wages and working conditions so that staff can be recruited and retained. In those homes that are an emergency, where the local hospitals are too overstretched or have outbreaks themselves and cannot send in teams, or it's delaying teams being sent in, we're calling for the military to be deployed. People are dying at a rate that we have never seen before. We need the help. We are calling for improvements in infection control and actual enforcement by the provincial government of infection control standards in the long-term care homes. The homes, we know, particularly the for-profits, are doing what they can get away with. There has been no accountability. No one has been fined. No one has lost their license. And the homes have taken the message. And the infection control levels are not adequate in the homes. And that's why we're seeing such horrific outbreaks. And finally, we're calling for the long-term care residents, staff, essential caregivers to be vaccinated, subject to their right to consent, of course, as an immediate priority to save lives. I'm going to turn it over now to family member Anna Tomlinson, whose mother Gloria is in a long-term care home in Barrie, to describe what's going on there. Anna.
Thank you, Natalie. So yesterday I showed this picture at the protest. This is my mom. And I wanted to share that that was her when she was healthy, in her happy place. And I wanted to share that picture because I wanted to humanize this issue. My mom is a very real person, and we care very deeply for her. She's a very wonderful mom. She was 81 years old when we placed her into her retirement home due to the complications of late-stage dementia. So this is her story. My mom can no longer walk or bathe herself. Just so you understand, she needs full assistance to drink and eat. She's connected to a bed alarm 24/7 or a chair alarm so that she doesn't fall. She is incontinent and she requires a Hoyer lift to be transferred. Mom's dementia has caused her to suffer greatly because she has had hallucinations from her disease. She can sometimes be agitated and confused, but my mom has always known us. Since the day she went into long-term care, we requested that she never be left alone in her room because she loves to be around people, and we wanted her out where she could say hi and feel like she was social. So when COVID hit in March of 2020, my sister and I, who are my mom's essential caregivers, and the privately paid workers that were going in to supplement the minimal long-term care that was provided in a government-funded home, were told we could no longer go in. And this is what I want you to hear. What that means for my mom is that now she is left alone in her room most of her day, the thing she most feared. It means that when she calls out for help, she's more frequently not heard. It means that if she falls asleep during a meal and she's thirsty when she wakes up, we can't be there to make sure she gets her fluids. It means that those disturbing hallucinations now have to be managed with medications instead of the support and visits of her family. It means that she cries more. It means that when she's left in a dirty brief, we aren't there to ask that somebody changes it. It means that we can't see her care to advocate for it. During the first wave of COVID, we were locked out. Yes, we had FaceTime calls, but you need to understand that FaceTime calls are not a solution. My mom is not able to engage in a FaceTime call. And more than once, she was crying or screaming on the other side of the FaceTime call, and it is absolutely heartbreaking to not be able to properly comfort her. During the first wave of COVID, it was 186 days until my sister and I were able to then go in and see my much declined mom. On the day we finally saw my mom, she did look at me and say, "I was lost, but now I'm found." And we all cried and we thought, okay, but this is never going to happen again, right? Despite government guidelines, which has advised long-term care to always allow at least one essential caregiver into a home, it has now been another 28 excruciating days and counting since we've been able to be inside and provide my mom with the essential care that she needs. Listen, I am not coming against the hardworking PSWs, nurses, and doctors in my mom's home. In my experience, these are very hardworking people doing an incredibly difficult job in an incredibly difficult situation. But there's just never enough of them, even in one of the better homes. So I'm speaking up today because our seniors in Ontario are rapidly dying from COVID, but they're also dying from isolation and neglect because our long-term care system is broken. It's unacceptable, it's inhumane, and I'm speaking out for every senior because they deserve better. And my beautiful, precious mother, Gloria, deserves better. So please stop the genocide. Thank
Anna,
you.
we're so sorry. Thank you very, very much. Thank you. Hard, eh? It's hard not to, sorry. Joanne Beggs. Joanne's is a resident of Mississauga herself. Her mom, Barbara, passed away in October in long-term care. Her father, Bob, is in long-term care in Oakville. And for the media, I'll put the speakers' names in the chat. Go ahead, Joanne, you're on mute. Sorry, hon.
Thank you, Natalie. Late 2019, both my parents entered a long-term care in Oakville. My mom died October 9th after 10 months in long-term care. My dad survives his wife of 68 years, now 16 months in long-term care. This is a picture of them holding hands the day my mom was admitted. They'd been separated for 6 months because of her hospitalization. Having been locked out from in-room visits for about 6 months, I'll speak to the impressions with which I'm left of the lack of staffing in homes and what it meant to my parents based upon experiences, conversations, observations since allowed back in, based on behavior, care fails, and follow-up/callback issues I've experienced. My mom entered long-term care at 91, deaf, blind, and bedbound. She became quadriplegic, losing the loss of her hands during lockout. She was, in my opinion, pathologically isolated, probably 22 of 24 hours alone in her bed, calling out for help, calling out in fear due to delusions, for water, waiting, frightened, confused, in chronic acute pain, too often alone. From admission, I advocated that my mom was legally disabled and entitled to accommodations to support her needs and health. I grew to almost beg for recreational intervention. I was told they offer it when on the monthly calendar. They could be bedside. Some months it wasn't even on the calendar. I practically begged for bedside animation, music, reading, anything. Again, minimal is my impression. She became more lost in her delusions. I believe the lack of availability and presence of staff had a negative effect on her socially, mentally, and emotionally. She lost use of her hands. The changes were discussed before COVID lockdown. A referral to a Botox specialist in an attempt to retrieve use of her hands was too late, probably 5 or 6 months after lockdown. Too late. Why was this not acted on sooner? Staff were aware before lockdown. Subsequently, with the loss of her hands, our daily calls dwindled as she couldn't hold the phone. Calls were accommodated, and I'm grateful. Calls were to be at either 11 a.m. or 6:15 p.m., facilitated by the nurse. Barriers? No one answering the phone, being too busy, or not willing. Worst example, being told, I'm going on break, call back in 45 minutes. No, I won't help you now because I'm going on break. Call back in 45 minutes. I call back in 45 minutes, no answer. I call again. The person picks up, says, I'm too busy. I express my upset and dissatisfaction. If you're not happy, call the clinical director. I did. Mom asked me one day if I was angry with her. I realized she was trying to make sense of why her daughter, her stated safety, who called her at least once a day, was calling her infrequently and not visiting. Painful. Too many days with no contact for lack of staff facilitation. Perhaps 2 months before her death, waiting on a window/phone call visit, I heard staff tending to my mom's hygiene. My mom yelping in pain, pleading, stop, stop, no more, please stop, stop. That day, 5 months into lockdown, I realized her pain was not adequately managed. I had to advocate too hard with the doctor and palliative consultant. I was told that she could be given a butterfly feed, which I requested for more efficient and effective pain management. But the problem was that she could still swallow pills, and nurses would end up complaining that it was too much work. Medical professionals putting staff needs before pain management. It still sickens me to think of the pain she endured. I did get it for her. She had 3 pain-free days, her only wish to not be in pain, and she died alone. As she declined, I attempted to speak with management to get permission to be bedside with her. 6 weeks with no callbacks. I finally reached someone to be told that they'd been out of lockdown for 2 weeks. No one had called me, told me. I choose to believe this oversight was due to staff being overextended. I'm left anguished, wondering how much my mother suffered social isolation, pain, and loss of her hands, and to what degree inadequate staffing levels played a role in her deterioration. My dad entered the hospital system early 2019 due to falls. March 19 discharge summary indicates a 1-person assist for transfer, walking, and toileting due to risk of falls. Upon and since entering long-term care, I've advocated repeatedly for this medically prescribed need and for safety. He's had falls, one so significant that half of his face was black and blue for 6 weeks. 1-person assist has not been afforded my father. He continues to be at risk every day without it. It recently was strongly recommended by the physiotherapist. I will be advocating for it again. In my opinion, this is medical neglect. I've been told by a nurse that it's not possible due to staffing levels. I've been told he's fine, doesn't need it, no need by management, and the lack of availability of staff was inferred. The grief and shock of losing his wife of 68 years greatly and quickly increased the advancement of my dad's Alzheimer's. He was often alone in the early weeks, grieving. I advocated for grief support, staff presence, and attention. My dad, the most positive person I've ever known, became suicidal before Christmas, citing the grief, isolation, and boredom under lockdown. I should suicide myself. I'll go stark raving mad with the loneliness and the boredom. In response to my reporting, he was monitored for days and is doing better. I'm grateful for that. I'm a fierce advocate by trade and by love for my parents. It's challenging dealing with long-term care. I always express my appreciation for the care, especially by those PSWs I know care deeply for my parents, and my belief that the inadequate staffing and priorities of for-profits are a deep disservice to residents, families, and to staff. Thank you.
Thank you, Joanne. Joanne, for the media, is your parents' last name Beggs also?
Yes.
Okay, thank you.
Mhm.
Thank you.
Yeah.
Okay, so next I'm going to ask Jennifer Penny, who Jennifer lives in Oshawa. Her mom, Yvette Breck, died just after Christmas at Oakwood Park Lodge in Niagara. That's a home that's in a very large outbreak. Okay, please go ahead.
Hi, good morning, everyone. I appreciate the opportunity to speak to you all and share my experience. And I hope that this will bring about the much needed changes and actions to our long-term care homes, the residents and the workers. The system, I feel, has failed my mom in many ways, and I was her caregiver for many years. In 2019, I had a back surgery and I had to put her in respite for 6 weeks. And I was told they would have a physiotherapist work with her to improve her mobility. And I was quite excited that, you know, she would come home in a better condition. But unfortunately, when I picked her up, she was in worse condition than when I brought her in there. And I could barely get her up the steps into my home. She had an infection, and I could tell that there was something other than the dementia in her condition. I ended up having to call an ambulance for her, and she was discharged a day later. At that point, her condition was so bad, I could no longer care for her on my own, and it was a crisis situation. Had she been returned to me from respite care in at least the same condition I put her in, she would have still been able to stay with me, and I would have been able to continue to care for her at home. So her spot became available. Unfortunately, the timing was really bad, and that was November of 2019. And she was put into Oakwood Park Lodge because that was the only available home in an emergency situation. And it was right before COVID obviously was coming out. And had I been able to have her at home for longer, she would have never ended up in there, and she would still be here. Regardless, my mom passed away December 26, 2020. She was 81. She had dementia. She had a heart condition, high blood pressure. So she was a high-risk candidate for COVID. Her home went into outbreak the third week of December, and we were notified by automated message. There was 2 automated messages we received just stating that it was a building-wide outbreak, but no information about her condition. I only found out through the news media that residents had passed away. And we spent approximately 5 days trying to reach someone at the home to find out her condition. Nobody would answer the phone or return voice messages or emails. There were times you would get through to the nurse's station and they would pick up the phone and hang it back up. And it was a really distressing number of days before we were actually able to speak to someone. And at that point, we were mistakenly told that she was negative. It was only minutes after speaking to that nurse that I received a call from someone working off-site that was calling families that told me she was positive, but that she was doing well and had no symptoms. So there was a lot of misinformation, lack of communication. It was difficult to reach the home. Over the next few days, we were told she was doing well. Until the 24th, I spoke to the nurse who told me that she wasn't quite herself that day and she was no longer eating or drinking. My brother received a message that night that she was doing well. So I was deeply disturbed about the misinformation, and I felt that I really just wanted to bring her home, and my cousin had offered to go that day to pick her up, but of course, you know, that's not possible. Sorry. The following day was Christmas, and we received a call from the home saying that she wasn't going to make it through the night. So my son and I left from Oshawa to drive to Niagara Falls in the middle of a snowstorm. We were so distressed if we would make it there in time to see her. When we arrived, there was nobody there at the door to let us in. We were banging on the door for several minutes. Staff came to let us in. There was a resident sleeping in a wheelchair in the hallway. There was nobody around. The nurse's station was empty. A nurse and another staff member came to see us. They ushered us back out to the front area to put on protective equipment. And then we were asked if they would like us to check on her first because they hadn't been in her room for a while, and did they want us to see if she was still alive before we went in. So it was really distressful. We went in and she was on oxygen. She wasn't awake or responsive, and she passed away within a half an hour. My daughter had made her way from Guelph and was at the door wanting to see her grandma, but there was no one to let her in, so it was too late for her to see her grandma.
Mm-hmm.
The nurse was really upset and overwhelmed. She was in tears. She said she had been working for 16 hours. There was not enough staff. Staff had walked out. She was doing everything she could. And we left that evening. And as we left the building, there was a woman in a wheelchair in the hallway calling out to us, asking her to bring her water. There was nobody around. It was like a ghost town. It was just empty, and we were struggling with the decision of whether to bring her water because we didn't know if she had COVID and we could possibly infect her, having just come from my mother's room. So the following days, we weren't able to grieve the loss of my mom. We were more focused on the residents that were left behind. We knew that there wasn't enough staff to care for them and that there was neglect and suffering going on. I had asked them how they came to the determination that my mom had stopped eating and drinking. And I was told that that was the job of the PSWs and that there was no staff. So my mother, she never stopped eating or drinking. She just wasn't being fed. I reached out to the media, the Premier's office, long-term care hotline, the local MPP, and we did everything we could, thinking we could get someone in there quickly. But yet a month later, there's still all this going on in so many long-term care homes. I think that the conditions our residents, our seniors, our family members are living in is horrific and inhumane. They've been shut out from the world, confined to their rooms. Most of them have dementia, have no idea what's going on. They've lost contact and touch with family members.
Okay.
It's horrifying to think that the only people they see are in gowns and masks, and this shouldn't have happened. They had the staff, they knew what was going to happen, the second wave, and they could have been prepared. They should have been prepared. And there's really no excuse for what has happened in these homes and to the workers.
Thank you very much, Jennifer. We're so sorry about your mom. Thank you. And Jennifer, you mentioned also that even though they had announced that the hospital was sending in a team and had put that in the papers, it was not for days before any of that team arrived in the home.
Niagara Health had said on December 22nd that they were stepping in to provide temporary support, but we were there on the 26th. And obviously 4 days later, there was no staff. Okay. So more residents passed away in the following days in the same conditions.
Okay, thank you very much. Okay, we're going to move through quickly. We're almost done for the speakers. The next one is Debbie Schubat, and Debbie's mom, Amy, is in Southbridge Roseview in Thunder Bay, which is another home that has had a very large outbreak and is not clear totally of the outbreak yet. Although I don't think they've had any new cases in the last few days. Debbie, please go ahead.
I just want to show you this picture of my mother and my beautiful niece, her granddaughter. This was taken before the outbreak. My mother, the outbreak at Roseview started on November the 17th. She's in a private room. The outbreak started on the first floor. I was told that the outbreak would be confined to that unit. However, on the 26th of November, my mother tested positive for COVID. She has dementia, she's 92, and I have been a fierce advocate for her ever since my father died in 2017. We were kept out of the home from March until the end of August. And on August the 17th, I had a conversation with one of the managers because of the frustration of not being able to get back into the home. And at that time, she told me that she didn't have time to work on the essential caregiver policy, that she was working on the second wave and that she had a long-term care home to run. We didn't get back in until the end of August. And finally, after a few weeks with lots of family going in for essential caregivers and other family, she started to rally. My niece and her granddaughter sings to her every Friday night and has done so since my father died. It was a little bit of joy in my mother's life. Since the outbreak was declared, we haven't unfortunately been able to secure private caregivers or family members who are willing to go in. There were 61 staff, 92 residents, and 23 deaths over this outbreak. There is still one positive resident at this time. There were 148 to begin with, so we've lost 23 residents. And I'm speaking on behalf of other families as well, because we have been talking, and I'm aware of the circumstances, especially at the beginning of the outbreak, of the extreme staff shortages. A ministry inspection report from December the 17th that confirmed that residents in the initial unit were allowed to wander, that there were PPE violations, numerous, and failure to even sanitize hands amongst some staff. I don't blame staff. I've been so pleased with what the staff have been able to do, both PSWs as well as the clinical staff, the medical staff, the dietitian, etc. But this is inhumane and it's gone on far too long. My mother had a speech language assessment, swallowing assessment just before the outbreak was declared. And I was assured that she was able to manage with her food, a minced diet and thickened fluids. Now I'm told that she is on pureed food and she's pocketing her food. So I fear for her condition, and we're desperate to get back in there. Thankfully, she's having the vaccine today, and they are proceeding with that for most residents and staff. In conclusion, I just wanted to say that every time I have a Zoom call with her, she's not verbal any longer. And one of the last things she said was to my granddaughter on the 25th of December, when she had the Zoom call, that there's nothing here for me. And so every time I hear her, the little that I do hear from her and see her, I can't stop thinking about her. I dream about her, and it has been my living nightmare for all these months. So on behalf of many families and several, like I say, who've described as essential caregivers the horror that had gone on, especially at the beginning of the outbreak, I want to say to Doug Ford and Mary Lee Fullerton, the Iron Ring wasn't there. And we are devastated. Thank
Debbie,
you.
thank you. Debbie, the media, would you mind holding up the picture again, but just a little higher because it was hidden behind your name, the way it shows up on the Zoom
Sure.
screen, and just
Sure.
maybe a little closer so that they can see it.
Sure.
And thank you very, very much.
Certainly.
And we're really sorry you're going through this. Obviously, we're very, very sorry. Just a little higher. There you go. Yeah. And if media need to, can you share that picture with them? Is that okay?
Sure.
Okay. Maybe you could send it to our email and then we can just send it to I think it's the Chronicle Journal in Thunder Bay. I'm not sure. Sorry.
Sure.
Okay. Thank you. Thanks very much. Okay, so finally, we have Patricia Tate. Patricia is from Sarnia Lambton herself. Her mom, Margaret, is in a long-term care home in Sarnia, and this is the final person. We also have Sandra here, and I'll introduce you, Sandra, in a minute. And just because we're way over time, Sandra will help with the questions and answers, and we'll move to questions and answers after Patricia. So, Patricia?
Hi. My mom is a resident of a Lambton County nursing home. She's 92 years of age. This is a picture of her, and this is at the home. And it was, I'm an essential caregiver, so this was taken like just last week. My mom suffers from heart disease and vascular dementia, among other things, and is wheelchair bound. She also wears glasses and hearing aids. My mom has resided in 2 different nursing homes where I've met some of the most caring, patient, and hardworking nurses, RPNs, and PSWs. I don't know how they do what they do each day. I could never do their jobs. So I very greatly appreciate that my mother has such caring people around her. In the particular home that my mom is in now, I have always felt that there's been good communication and that we've always been able to talk and resolve problems when they occur. Before COVID-19, I felt that things were going as well as they could, given the staffing situation, etc. But I remember my mom often would say, "No one has time to talk to me. Everyone is so busy." I would try to explain to her about all the work everyone had to do and that they just didn't have time. But then I started wondering, shouldn't or couldn't this be part of the care that's provided in a nursing home? At the home where my mother's at, there is a social worker who has about 14 hours a week to spend some time with residents and run a support group for caregivers and whatever other duties she might have. I know she told me that she tries to spend more time with those residents who have fewer or no visitors. And during COVID, she has spent some of her time phoning us, the caregivers, to see how we're doing. She's a great asset, but 14 hours a week just doesn't cut it. As time and visits pass by, my mom's dementia has marched on, and every time I was visiting, and this was before COVID, I was never unaware of how vulnerable these people were and how dependent upon the hardworking staff that were around them. My mom would often speak about wanting to go home, and sadly, I would have to remind her that this was her home. My mom went through a period where she was calling out at night that she wanted to die. I first heard this from another resident on her floor, and I also heard it from the various staff on her wing. Their solution was to medicate her to reduce her anxiety and allow her to sleep. It was my job to make the decision about whether that was to be done or not. Because I couldn't, with the staffing issue, see any other resolution, I opted for the medication, not to make it easier for staff or for me, but because I didn't want my mother to suffer the mental anguish every night of wishing to die. Enter COVID-19, and my mother's and everyone's world was turned upside down and shut down. Visits to my mom in her room changed to virtual visits, window visits, and behind the glass visits. And I was so thankful for those. I was amazed by how quickly my mother adapted, but I think her dementia was a blessing in this case. For the most part, my mother remained calm and happy to see us on these various types of visits. I was impressed with how quickly the staff adapted to the many changes that were thrust upon them. The home my mother is in has had 2 COVID-19 outbreaks, but both were contained to staff and no residents have caught it yet. I have just recently become an essential caregiver for my mom. This means that I need to have COVID tests once a week and wear a mask and gown to visit my mom. I'm able to go to her room, which I have not been in for 10 months. One of the COVID-19 setbacks in my particular case is that my mother does not recognize me with a mask on. I am hoping that this will change over time, but I find it incredibly difficult to go and visit her, and she doesn't realize that I'm her daughter. Anyway, the next part that I'm going to tell you is something that has happened after COVID-19, and it's directly related to staffing. My sister and I have virtual calls with my mom once a week, and it was on one of these virtual calls that my mom started complaining of abdominal cramps. This is often an indication that she has to go to the bathroom, which has happened before on a virtual call. So I called the front desk like I usually do and asked to be connected to her wing. I spoke to somebody there and was assured that someone would be there shortly. My sister and I watched 10 minutes tick by while my mother's cramps increased and she moaned in pain with no one around to hear her except us. And we were helpless to do anything, although we tried to comfort her as best as we could virtually. I called the front desk again and asked to be connected to her wing again and was again told that 2 PSWs were coming. My mom is in a wheelchair and she needs a lift, requiring 2 PSWs. 10 more minutes go by. My mom is crying now and calling for help. She is in so much pain, but there's no one there to hear her. I should mention that this is around lunchtime and everyone is busy getting the residents to their lunch in the dining room. This is torture for my sister and I as we try to comfort her. So I finally call the front desk again and the receptionist asks if I wish to speak to a manager, and I say yes. I explain our problem to her and she assures me that she will go up and handle it, which she does. And finally, 2 PSWs come to take my mom to the bathroom. Needless to say, I was frustrated by this point and I emailed the head manager and carbon copied my sister. I got an email back that instructed me to call the manager who handled the problem, which I do. I did receive an explanation, which I wasn't really satisfied with because as far as I'm concerned, it's a staffing problem. That being said, it's not their fault that they don't have enough staff. And I will conclude with saying that our elderly deserve better. People matter more than profit, and this situation has to change. Thank you.
Okay, thank you very much, Patricia. So I just want to tell the media, we have 100 organizations and direct family members of people in long-term care who have experienced this. We purposefully included people from all of the different regions of Ontario that we could, in order to show that this is not the minority of homes. This is not the occasional home. This is the majority of homes. This is many, many long-term care homes that are in a staffing crisis, the like of which we have never seen. And there's no care without staff. And so the interests of the families, the interests of the workers, they are the same here. We cannot continue this way. Staffing has crumbled in the homes with large outbreaks. We lost a lot of staff in the first wave. We've lost more in the second wave. There are thousands who have been off because they have contracted COVID-19. It takes them, some of them, months to recover. Some of them never come back. And the situation is unlike anything we've ever seen. On the call here, we have unions representing tens of thousands of workers in long-term care, CUPE, OPSU, ONA, UFCW, steelworkers. We have the family councils from all across Ontario. We'll put out a full list on our website and we'll send it to the media as well of who all is on the call. We have the major family advocacy groups, including Sandra, who is here from the Advocates for Long-Term Care Reform in Ontario, which represents about 4,000 families. Sparky's here from the Warriors group. There's a whole bunch of family groups. We have organizations, seniors organizations who have members in long-term care homes that they're concerned about. We have individual family members. We have support from both the OSSTF, the president of the OSSTF, Harvey Bischoff is here, and the president from the ETFO is also here in support. Sam Hammond, we thank you. Also other organizations from the Canadian Federation of University Women, chapters to the Council of Canadians, a whole array of community organizations whose members also are affected by what's happening in long-term care. Our message is that we're speaking with one voice. Together we represent about more than 1 million Ontarians. Sorry, I should mention the Canadian Pensioners Federation is here as well. So the large seniors organizations, we represent more than 1 million Ontarians. We're speaking with one voice. What the Premier and the Minister of Long-Term Care have said is patently untrue. There is a crisis the like of which we have never seen in long-term care. It needs immediate action. And we can no longer wait. No more crocodile tears, no more PR over substance. We need real action now. So we'll open it up to the media for questions. If there are media outlets that have questions, and also if you're looking for someone from your particular area, you could let us know and we can see who's here. Please just identify your media outlet in the chat and then we'll take your questions. Thank you. Okay, so Joel from the Pointer, please go ahead.
Hi, Natalie. Thanks for setting this up and thank you to everybody who shared their stories. I'm curious if there is anyone who can speak to the situation in Peel. The Pointer covers Brampton, Mississauga. And, you know, as everybody knows, both cities have been a hotspot of COVID-19 throughout the pandemic. And I'm wondering if that situation has mimicked itself in long-term care and if there's anybody who can speak to that situation in any degree.
Okay, so Joanne lives in Mississauga, but in addition, is there anyone here from a long-term care home in Peel region? Can you just identify in the chat? And Joel will come back, okay?
Thank you very much.
We'll just see who identifies. Okay, Sala, can you start to let us know who's in the chat? Because I'm not going to be able to follow.
Yeah, there's a question from Doug Dishak of TB News Watch in Thunder Bay.
Okay, please go ahead.
Hi, this question is for Debbie Schubot, who has her mother living in Southbridge Roseview. Earlier this month, it was reported that a staff member had reported to 2 shifts at the home after testing positive for COVID-19. I was just curious to get her reaction to that kind of oversight taking place at the home.
Hi there. Yes, I'm aware of that situation, and I think many families were shocked and horrified. I understand there was some confusion about why this person didn't answer her phone and notify. And she was trying to be notified by the health unit and the home about her positive status. So there's a lot of unanswered questions, I think, about that. The home did make a statement about that, and apparently the security guard didn't follow through appropriately and let her into the home. So I can't tell you much more than that. It's all been in the reported in the media to date.
Okay, Doug.
Just if I can ask a quick follow-up.
Yes, please. Yeah.
There was also a pretty scathing report by a provincial oversight committee on that was really critical of the home and saying that it found multiple violations that could have accelerated the spread of the virus. What's your reaction to a report like that and how the home, I guess, sort of didn't or allowed the spread of the virus through the home that could have been prevented?
Yeah, I'm familiar with the report, and of course, many family members had already been describing those situations, especially at the beginning of the outbreak. The home has responded and has told the community and family members all of the things that they have done. However, my concern is just that the outbreak has gone on for 2 months now. And the other issue is that there have been other positive staff members identified in other homes in Thunder Bay, specifically another Southbridge home and one run by St. Joseph Care Group. And none of those outbreaks developed beyond a few staff members. So I guess that would be a logical question to ask them. Why did this spread, and why has it gone on for so long? And why are 62% of the residents infected and 23 deaths? So I can't say anything more than that.
Okay, thanks, Debbie. Doug, are you good?
Yeah, that's all I have. Thank you very much.
Okay, thank you.
The next question comes from Nicholas Haddad of Radio Canada. Nicholas?
Hi
please
there.
unmute yourself.
Thanks very much for everyone who shared their story with us today, because they're incredibly powerful, and I understand it must not have been easy to share that with all of us. So thank you for that. I'd like to talk about enforcement very briefly. I'm not sure if I should direct this question to Natalie or to anybody else here who feels like they want to speak to this issue, but I keep hearing that essentially families are having to ensure some form of enforcement in a way that's pretty independent, and that creates an absence of any accountability with the government. So I'm leaving the question open. If Natalie wants to answer, I'd love to hear from her, but I'd like to understand your take on what can be done in order to enforce these guidelines that are supposed to be in place to protect residents and staff.
Mm-hmm. Okay, well, I can start, and maybe Sandra, you can add in here as well from the point of view of the families. But I mean, for months, since CBC did the expose that the Ford government had essentially canceled the comprehensive inspections of long-term care homes, we have been advocating that there need to be inspectors in the homes on the ground, if either from the ministry or from public health, to ascertain what are the staffing levels in the homes as they get into outbreak. I mean, all homes need to be inspected, but in these crisis conditions, the ones when they get into outbreak at a very low threshold, they need to be inspected. They can't take the word of the administrators because, frankly, they don't tell the truth. I mean, case after case after case of home, we're hearing that the administrators are even telling the media that there is no staffing crisis. And when families go in because their loved ones are dying, there is no staff to be seen. Their loved ones are dehydrated. I cannot tell you the number of people that I've heard from in the last week alone whose family members have not had a bath in 6 weeks or 5 weeks, or some cases 3 months or more in long-term care homes. Like, the basic care isn't happening. So they need to inspect, they need to make sure that there's a safe level of staff, that they have surge staff, extra staff to be able to deal with the outbreak. Because of course, as staff gets sick by the dozens, then the staffing just crumbles and the homes fall into the kind of chaos that you've heard from, Jennifer. And so immediate inspections, particularly when they get into outbreak at a very low threshold, extra help in, not after families have held press conferences to demand help, exposing that residents are banging on the walls, calling for food and water, or calling 911 to get ambulances in because there's not enough staff to feed them. We need a systematic response. Those homes where there's media attention, they've actually, they've gotten now, it's management agreements, not actual management takeovers in the majority of cases, but it's just a handful of homes across the province. There are 99 homes in large outbreak in Ontario at this point. There's only 626 homes. At any given point in the last few months, there have been 80, 70, now 99 homes in large outbreak, the majority of which do not have any help at all. Some homes where virtually all residents are infected, like Banwell in Windsor, and there's no intervention whatsoever because there hasn't been media attention around those homes. I mean, so one, They need inspections right away from local public health or the ministry. They need to get staff in there. They need a systematic response that gets staff teams in there to help. They need to be inspected and held accountable for enforcing safe infection control protocols, which is not happening in these homes where the outbreaks have gotten out of control. When they send in a team, after 50, 60, residents and staff have been infected, it's almost impossible to stop those outbreaks. That the evidence is very clear about that. And the homes have taken the message from the provincial government, which made a priority this fall of passing legislation. Instead of doing all of this and preparing for the second wave and so on, what they did was prepare legislation to indemnify the homes of liability for negligence, to raise the bar so that anyone who tried to sue had to sue for gross negligence, and to lower their bar for the defense to make it easier to defend the homes. That was their priority. What we needed was enforcement, a clear message to the homes that they will pay a price, a financial price, and they'll lose their licenses if they're negligent and incompetent in the way that we've seen. And that just has not happened. In terms of families, I mean, they call the ministry, they call for inspections, they report all of these things. Sometimes we're hearing from families that they don't hear back for days and days. Sometimes they don't hear back at all. There are inspection reports, there are compliance orders, but there are no penalties associated with those. Nothing happens, and the homes know that. Sandra, did you want to add anything? So this is on the provincial government. I mean, to be clear, the provincial government has the power to change this. They have the power to fine them. They have the power to suspend their licenses, to revoke their licenses. They have the power to enforce this, and they also have it in their power to deal with the staffing issue, and they're not doing it. Sorry, go ahead, Sandra.
Yeah, no, I just wanted to add that this is a change that can be made relatively easily and quickly because the inspection teams are already in place. Why not just give these inspectors the authority to issue the fines, to hold administrators accountable if they're not doing a good job, and if they can't run the home, fire them. This is something that won't cost government a ton of money. They keep saying that funding is always an issue. This is already in place and ready to go. They could have it available tomorrow if they wanted to.
Okay, thank you. Nicholas, did you have more?
I do have a quick follow-up question. It's very clear. You've made a couple of demands that you listed just now and at the beginning of the meeting as well with regards to the military and so forth. I have another question for you, which is, are you expecting Minister Fullerton to resign based on what we've seen over the last year?
I mean, she hasn't. It's not usually for that. I mean, many of the groups here have called for Minister Fullerton to resign. When Minister Fullerton likened the COVID-19 pandemic to a bad flu year in the fall, we also called for her resignation. I think it's absolutely clear she's lost the confidence of the entire range of organizations here. The advocacy groups, all of us who've been around for decades, we've never seen a minister like this. This is, it's very shocking. The tone, the deafness, the tone deafness of her response, the lack of empathy for the families and for all of the people who've died, the discounting of the staff, the suffering of the staff who've become infected and who've risked their lives going into the homes, the downplaying of the numbers, the dissembling, the falsehoods about what's going on. I mean, it really is beyond anything we have seen. So bottom line, yes. That is not, we didn't ask people who joined this call to endorse that. I feel secure in saying at least the vast majority of people here would feel the same way. But the Health Coalition, it's not, we don't generally call for individual resignations and things. That's not, we don't like those kind of politics. We just need a competent minister who does the job, and we, have lost confidence in that. More importantly, the Ford government has voted on the measures that they've taken. The entire caucus has voted. On the staffing, they voted before Christmas. They announced their staffing plan December 17th. And that plan is to get improved care to 4 hours of care 5 years from now. The first increment of which they said would be 15-minute improvement in care, not this April coming up, but the April afterwards is the deadline for that. And meanwhile, we have one person dying an hour in long-term care in Ontario. It's just despicable. So this is on the entire government. It's on the entire caucus. They are responsible for these decisions, and we are asking them to change these decisions.
Natalie, may I speak for a minute here?
No, sorry, Dennis.
Yes. I just wanted to add to the fact that I don't think that this government is going to do anything when people are former premiers of the province are sitting as chairman of many of these long-term care facilities, and they're certainly not going to call them to task. And that's why nothing is happening.
Okay.
And that's
You
the
make
truth.
a good point. I'm afraid we have 100 people on the line, so we just can't let everyone speak. We're going to keep it to the speakers today, but Dennis, it is a good point. There are too many connections between the government and particularly the for-profit long-term care industry. Nicholas, did you have anything else? Sorry.
No, and thanks very much for your time and for answering my questions.
Thank you. Salah?
The next question comes from Sue-Ann Levy of the Toronto Sun.
Sue-Ann. Is she still with us?
Yeah, I just unmuted myself.
Okay.
First of all, I just want to give a huge shout out in front of everybody to Natalie, because I too lost my father on November 29th, and your stories actually made me cry this morning. And Natalie was a wonderful source of support when I was dealing with the very same things that you were talking about today. I wanted to ask Jennifer Penny and all the ladies, were these long-term care for profit homes or non-profit? And the second part of the question is, I've written a lot about this, about my own experience, about homes, about retirement homes, long-term care homes. Was this preventable? Was all of this preventable? People have said to me this was 100% preventable. I think in my dad's case, it was as well. Maybe some of you can comment on that.
I'll just, Joanne, for profit or not for profit? And was it preventable?
For profit, I feel like it's preventable. I want to say I find what is happening is sadistic, and I find it obscene that for-profits are getting such amounts of money, giving so much to shareholders and not delivering to frontline. To me, it's appalling that they're actually treating their staff like this. And the lack of staffing. I was told recently, we're staffing at ministry levels. That doesn't mean it's adequate. You know, absolutely, I think this could be prevented. I think it's greed that is at the root of all of this. And it's a very discompassionate system on all levels.
Thanks, Joanne.
So sitting on the money.
Okay, thank you. And then Jennifer, for profit?
Yes, for profit, and absolutely could have been preventable. Just as everyone knows, they had said the second wave would be worse, and so they knew what preparations they had to make for staffing. And even the local MPP out that way, Wayne Gates, had been advocating long before the outbreak for this, and it was ignored. And absolutely the lack of staff and preparation, and the fact that they continue to let this happen when, you know, the military has been an offer to come in and they've refused that help. I just don't know why, because, you know, the numbers don't lie. The numbers are going up every day, and the residents and the staff and the doctors and the workers that are all screaming for help, they're not lying. You know, we're not lying. The problem is there, and it's gone on, and they've done nothing. They've done nothing to send any help in, and the help that is available. So absolutely, many hundreds, thousands of preventable deaths.
Thank you, Jennifer. And in that home, Oakwood Park Place, you know, the staffing team to come in from the hospital was delayed because the Niagara Falls Hospital has a facility-wide outbreak, and they didn't have anyone to send. They had to get the Shaver Hospital. The Red Cross, by the way, is only able to do very limited things. They have high school education. The people they're recruiting have a high school education and a police check. They can't feed people. They can't bathe people. They can't do that. So that's why we're not calling for the Red Cross. They did an assessment at Oakwood Park. They deemed that the work that they could do would not be helpful. By the end, they finally got the Shaver Hospital to step in and help, but it was very delayed. And this is why we're saying we need the military. It's with, thought. It's not our first proposal at all, but it's not our favored proposal, but it is necessary at this point. Okay, so Patricia, for profit or not for profit? And could it be prevented?
My mother was in 2 homes. The one she's in now is not for profit. The one that she was in before was a government, and I did notice a difference in the care, simply because they seem to be better staffed. Yes, I think it is preventable because it's all related to staffing, and it doesn't matter whether it's government run or for profit. There isn't enough staff.
Okay, thank you. And Debbie?
It's a for-profit home. Yes, it could be prevented. Imagine if this was going on in hospitals. Can it be prevented in hospitals?
Yeah.
I don't get it. I don't get it.
It's a totally different standard of infection control, completely different. Same resident gets transferred to a hospital, has a completely different level of care.
Right.
Thanks, Debbie.
They brought in 55 agency staff to the home to deal with this from out of town, presumably Toronto.
Up to Thunder Bay to Southbridge, because there were no staff locally to get. And when they leave, there still will be no staff locally to get. Anna?
My mom's in a not-for-profit home, but I will say also prior to that, she was in a profit retirement, like in a retirement home. And that was just a horrendous experience too. This isn't just a COVID situation. She survived 3 months there, and then we had to remove her under a crisis request to the long-term care home because she would have died where she was. So this is more than just a COVID issue. But yes, you know, these things could be prevented if the proper funding and effort was put into really focusing on where the issue is, which is in seniors' homes. These are the people who are dying. So that's what I want to share.
Thank you, Anna. Okay, Sue-Ann, thank you for your very kind comments. I'm so sorry about your dad. Okay.
The next question comes from Sawyer Bogdan of Global News London.
Okay,
Sawyer?
and the Independent has a hand up. I'm not sure if that's because they're, okay. Sawyer?
Hi, I just want to say thank you to everybody who shared their stories. I think it's pretty hard to meet anybody that hasn't been impacted by COVID. And I also know what it's like to have a loved one in a long-term care home right now, battling it. My question though is for Patricia in Sarnia-Lambton. Can you speak on the staffing issues? Was it just as bad before the pandemic hit, or is it, and that's continued, or is it something that's just been getting progressively worse during the pandemic? And are you willing to identify which care home your mother's in, or what the current outbreak status is that they're dealing with right now, if they are?
Right now, the staff, they just came out of outbreak. And as I said before, they've had 2 COVID outbreaks, and it's been limited to staff, and none of the residents have had COVID-19 yet. Yes, I saw that there's been staffing issues before COVID because they would be saying when I would go in and visit, they would talk about being short-staffed or people not showing up or whatever. So that was an issue before. I think from what I've seen, just from the incident that happened with my mother when we were on a virtual call, I would say that it's got worse, because that I did not see anything like that happen before COVID-19. I choose not to identify the home that my mother's in because I don't think this is well, I shouldn't say that. After hearing some of the stories, obviously in some cases, it's not just the fact that there's understaffing, but there's things going on in that home. But I view this as a more universal situation across all homes. And I do feel that by and large, this home is doing even though it's a for-profit, they're doing a pretty good job, the best that they can with the staffing that they have, with their allotted or allowed.
Okay, did you have anything else, Sawyer?
Thank you. I just have one question, and this might be more general, but I guess it seems to be a common theme that in a lot of cases there's just not enough staff to adequately take care of residents, and I think a lot of healthcare workers have decided to some have decided to leave the profession or for fear of their own health during this time. What do you think needs to be done in order to retain staff and entice more to come into the profession?
Okay, we have, you're from, where are you from? Sawyer, sorry.
London, Ontario.
Okay, we do have a staff member from the Banwell home from Southwestern Ontario. This is a home that almost virtually every resident has tested positive. And she wanted to say something about what was going on with the staffing there very quickly. Shannon, did you want to just quickly tell people?
Yep. So our staffing has always been like 1 PSW to maybe 11 residents. So when we had our outbreak and it hit, we had a lot of staff that went down, and we had 2 PSWs. I was talking to them with 3 sections. So that's like what, 40 people, 35 people that they had to take care of. We didn't have staff. We didn't. And thank God that these 2 girls were amazing. They're amazing PSWs. And, you know, a week later, we're getting agency staff, which thank God they were there, but some of them don't know they don't know the residents. They don't know the routines. They don't know what they're doing. Some of them are there just for the money, so they stand around doing nothing. And some of them are there to actually take care of people. And, you know, like, it was a little too late. And my administrator and my DOC are amazing, and they've done a very good job to support us and do what they need to do. But for-profit homes, they don't care about the residents. They care about the money.
Okay,
that's all they care about.
So when you're down to 2 PSWs for, a unit, which could be anywhere from 28 to 33 residents, there's no time even to feed everyone. I mean, it's not possible to even do that. So
well, I'm on the floor as charge nurse helping, because you know, you have to. There's no ifs, ands, or buts. The only thing that we're caring about right now is making sure that people are changed and making sure they're fed. Bare necessities. There's no hair washing, there's no bathing, there's no nothing. If you get a bed bath in, you get one in. If you don't, you don't. But you're feeding people and you're changing them. That's it. Everybody's in their rooms. They're all locked down. It's horrible. It's absolutely horrible. Okay, I've lost so many residents to depression in the first wave because they were locked in their rooms. And now they're locked in their rooms again. And they're dying on me. It doesn't matter what I do.
So sorry. Thank you for saying that.
Thank you for letting me talk.
Okay. Sorry. I just wanted to make sure that you heard that's one of the hardest hit homes down in Southwestern Ontario.
Sorry, I just want to confirm that's Banwell Gardens in Windsor?
Yes.
Okay, thank you.
Okay, any next questions from the media?
Yeah, the next question's from Maria Iqbal of the Hamilton Spectator.
Okay, we're going to try and end within the next 8 minutes. So I'm going to try and, Joanne, I see your hand, but I'm going to take the questions first, okay? Thank you, Maria.
Hi, thanks for taking my question. I was wondering, having heard some of the family members describe, the effects of having the staffing shortages, for example, like having to wait a long periods of time to go to the bathroom, or to, perhaps affecting their feeding. So I was wondering if Natalie or if any of the organizations wanted to comment on the way that numbers are being reported by the homes and public health in terms of where they report primarily deaths that are simply of people who've been infected by COVID, when there are likely others that are the result of neglect.
Yeah, maybe Sandra wants to add in on this, but I think it's very hard to kind of measure the total all of the total impact of COVID-19. I mean, the deaths that are being reported, as you're saying, are the people who died as a result of COVID-19. But so many people have suffered in such significant decline in their health and have never regained it, or have died essentially of neglect and loneliness and despair, of inadequate feeding and inadequate hydration, the effects of inadequate hygiene. I mean, you know, all of those things have had a huge impact. People in long-term care homes, they have really very acute, very high complex level of care needs in Ontario. And so many will have foot infections that are, you know, not being dealt with. They'll have infected pressure ulcers, bed sores that are, I mean, it's an unbelievably horrifically painful thing to leave those unattended. And when people aren't repositioned, of course, they get bed sores and they get worse and they get infected. They have, you know, all kinds of healthcare needs. They have pain that is not being dealt with. All of that. I mean, people are really suffering. There's no way to measure, I don't think, the full suffering that's happening, but it's a deluge of grief and suffering in long-term care homes. I think for the government to pretend that it isn't happening or downplay it is so offensive to so many people. And that's why we've gone to this kind of extraordinary length to hold this kind of press conference. On the actual measures, I don't know how they would measure all of that. I mean, it would be great, it would be helpful if the public health units would make public what they can about all of the kind of, I don't want to call it collateral damage, but I think that's what you're trying to get at, that has happened as a result of the inadequacy of care in the homes, and not letting the essential caregivers in, and not providing the care, not moving people out to hospitals or field hospitals to sequester them and protect them and get enough care for them, and so on. All of the things that have not happened to get care to people in long-term care in Ontario. Sorry, I went on. Sandra, do you want to add? I just want to give you a chance.
Yeah, no, I just wanted to add that, like, yes, currently anyone who has COVID and dies, their death is recorded as a COVID death, but we have no way of knowing if they actually died of COVID or of neglect through dehydration or malnutrition. And, you know, like Natalie said, that's a problem. We'll probably never know the numbers. And it's unfortunate because a lot of these people probably could have survived had they had hydration and nutrition.
Thank you. Did you have another one, Maria?
If I can, there is one more question I was going to ask you about, and it's with respect to the recommendations released by the Ontario COVID-19 Science Advisory Table. I don't know if you saw their science piece that was released this week, but they're promoting a number of measures such as improving staffing, as well as optimizing data in long-term care homes. And the Ontario Medical Association also released recommendations in terms of having paid sick leave for workers. So I was wondering if you could comment on those recommendations.
Mm-hmm. Yeah, I mean, I think there's a total consensus everywhere. The Long-Term Care Commission has made a number of recommendations around improving staffing and improving infection control and so on. None of those have happened. All of these recommendations, there's just I think what's notable about them is the depth of the consensus across the board about what needs to happen. I think we have to get a lot more specific though. I mean, the model of Quebec is what we're suggesting now, because we are in such a crisis, and vaccine or no vaccine, the staffing crisis, the care crisis in long-term care is not going to be addressed unless they actually recruit the staff. To do that, they have to improve the wages and working conditions and make it safe for staff to go in and retain them. There's a lot of burnout now. There are a lot of staff who are older and are just hanging on to get through the pandemic and then are going to retire. I mean, we're hearing this all over. So we're losing more and more and more staff. The trajectory is not up. The paltry announcement by the minister that, you know, in Ottawa, where her riding is, they're going to do a pilot starting yesterday, a pilot to hire 300 staff, train 300 staff, 300, that's it, locally, and have them have free training, not paid training, 4 days a week and then work for free in the homes 1 day a week. I mean, what is that? It's just ridiculous. It's ludicrous given the scale of the situation. And quite shocking that, she chose her own area to do it in. At this point, we need thousands of staff. So we're saying right away, should have happened. We called for it in the summer. 2 million people represented, we had organizations representing 2 million people calling for staffing teams, calling for Quebec's model of recruitment in the summer. Those people would have been trained and in the homes by the second wave had the government listened. They have to do it now. It is possible to get that several thousand, PSWs, 10,000 PSWs up and into the homes within 4 months. That's what Quebec did. And fast track wherever possible the training for the RNs, RPNs, and get them into the homes. We need thousands of them, not 300 in a pilot project starting after, the worst crisis that we've ever seen. So, so our comment is they just need to move on it. We don't need more waves of recommendations. There's deep consensus. What we need is enforcement of the existing standards of infection control, real enforcement, penalties, and pulled licenses. And we need the staff in the homes. We need them yesterday. We need them as soon as humanly possible. And the military. Sorry. Sorry, is that good? Sorry. Okay, anyone else for questions?
Yeah, the final question from the Independent of Petrolia in Central Lambton.
Okay, thank you.
Hi, Natalie. Can you tell me how many homes do you think need the help of the military right now?
I don't have a number. I don't even want to speculate. We're going to put out right after this, we'll put on our website the homes in large outbreak, the 99 homes in large outbreak. Only a few of them actually have teams in. All of those homes have more than 10 residents and staff infected. So they're at danger of, blowing up. Like many of the homes have just, the numbers have exploded. So all of those are homes in danger right now, currently in the second wave, and need to be inspected. The staffing needs to be shored up as a priority in those places, et cetera. Of the large outbreak homes, we think about 17 of them have virtually every single resident infected, and scores and scores of staff. And so those homes will all be in crisis where there are not teams in, and there's only a handful of those that have teams in. So I don't have a firm number, but I mean, we're looking at somewhere between, I don't know. I don't want to speculate off the top of my head. I'm sorry. It just wouldn't be accurate. I'll look and try and figure out. But I mean, really, they need inspectors in from public health units, either the local public health unit or the ministry, to really assess for real the conditions and have a good list. I mean, the last time they had 5 and then took one off and added 1, so 6 in total. That was too few for the situation in the first wave. I don't know what capacity the military has. It's a very hard question to answer, but a good one. Really, the minister should be answering that, but I mean, they're just in denial.
You were talking about a program to rapidly train PSWs and get them into the homes. If they said yes today, when could you get those people into the homes?
Well, in Quebec, they launched the recruitment program June the 1st. The government of Quebec launched the recruitment program, so it had the full weight of government behind them. They had hired 7,000 of the 10,000 by the end of August, and then into September, they got to 10,000. They had 60,000 applicants, more than 60,000 applicants. They paid $21 an hour for the training, so they paid them to be trained. It was a 3-month course. They paid them $26 an hour in the home, and they raised the wages of the PSWs. They're called orderlies in Quebec, so PSW equivalents in Quebec as well. To be able to retain them. And then so within 4 months, they were into the homes. They were in time for the second wave. The other measure that the government of Quebec did was that at the end of August, they have 400 approximately homes there. They hired a manager for each home. They had homes that were like multiple homes under one manager. So they hired a manager for each home. They paired them with an infection control specialist, and they required them to be accountable for infection control measures in the homes. You'll see in the media, there are some reports of homes that have fallen down for sure on that, but they had a far, far, far better second wave as a result of these measures. It shows you a government that's actually serious about dealing with it, that has taken responsibility. I mean, the government actually said we take responsibility for what happened in the first wave and took measures to try and address it. And they really have, quite seriously, compared to Ontario, which has really substantively done very, very, very little. What the one most recent measure is that they have increased the surveillance testing to 2 to 3 times a week, rapid antigen testing for the staff, backed by PCR testing, the sort of gold standard PCR testing. So they're doing more frequent surveillance testing, but if they're not cohorting the residents, if there's nowhere to put the residents, if there's no care for the residents, there's no one to stop them from wandering, et cetera, that is not going to do it. I mean, they know this. They've just chosen not to spend money to improve the staffing levels in the homes.
I'm sorry, I just had one more question. You touched on rapid testing, and I've been trying to get numbers on how many homes in Ontario actually are using rapid testing for employees. Do you know?
No, it's so odd because there were, like in November, 1.4 million rapid antigen tests, and we were told that it would be, very, very quick and it would be widespread. And then that never happened. And there was no news on supply and no news on numbers. In December, they updated the directive around surveillance testing and have required homes. Again, this is not totally clear to me whether it's homes everywhere in the province or in the hot zones or what, because I think the whole province is kind of considered to be in gray because of the lockdown. So not total, this is not totally clear, but definitely the homes in hot zones to do this rapid antigen testing every 2 to 3 days. Again, there's no enforcement of that. So if the homes don't do it, there's kind of wiggly wording in the directive that says as close to as you can kind of thing. And if they don't, there's nothing really happens, but they're supposed to do it. It's in their interest to do it. I think many of them are doing it, but I don't know whether it's absolutely everywhere. I don't have the numbers, sorry.
Are you aware of whether it's being done in Windsor? Like in Southern Ontario, I don't know of any homes that do rapid testing.
I've heard it's being done in Windsor. Is Shelley, you're on from Shelley Smith. Are you still on? Do you know about your homes there? I don't know if she's still on. I can ask, but I think so. Tracy, do you know Tracy's on? Tracy Ramsey?
And nobody else call her, but then people are dropping or there's a sick call in the middle of the night.
Hi, Natalie, I'm here.
Okay, Shelley, yeah, are you guys getting the rapid antigen tests down there?
I know there's some homes that do have it, but I don't believe all homes have it.
Okay, and Shannon's shaking her head no. You guys don't have it at Banwell?
We don't have it at Banwell. I do know that there's like 1 or 2 homes in Windsor that does, but we don't. And I think it's down to the cost, to be honest. Like I'm sticking a thing in my nose every week when we could have rapid testing. I don't get my tests back for 3-4 days sometimes. And it depends on which day you're doing your testing. We had to move ours to Sunday, Monday, because everybody in the area was doing Tuesday, Wednesday. So we weren't getting our tests back for a week.
Okay, thank you.
You're welcome.
Natalie, if I can just say, sorry, it's Mike also with 2458 with Shelley.
Hi, Mike.
Hi, good, Natalie. How are you? Thank you very much again for having this. But the problem with the rapid testing is that it's the accuracy as well. We're hearing reports of anywhere between 50 to 60% accurate.
Yes. I don't know about those percentages, but yes, there is an issue with them. They're supposed to back them up with PCR testing as well. Yeah. Okay. Anyone else? Any other questions from the media? Okay, we've gone a very long time and I see that many media have stayed on for all of this time. We really are so grateful for you for telling these stories. And I mean, without you, many of these homes would not have any help at all. And so really in the public interest, you have done a great service. Thank you to everybody for joining today. We really appreciate you being here. We'll put up on our website and we'll send out the large outbreaks report, the high percentages of people infected report, those charts that I gave you. And hopefully we can get some real response from the provincial government and some action. So thank you. Thanks everyone very much. Bye now.